Hey guys, it's Medicosis Perfectionalis, where medicine makes perfect sense. In previous videos, we have talked about the lymph nodes, the lymphatic systems, and the lymph. Today, we'll talk about lymphatic drainage. Whether you are studying for anatomy, pathology, internal medicine, oncology, even surgery, this video is for you. With that being said, now let's get started. Lymphatic vessels are also known as lymphatics. They drain fluid from the extracellular space, and then they drain this fluid afferent lymph vessel, lymph node, efferent lymph vessel. After the efferent, we have lymph trunk, followed by lymph duct. The lymph ducts will end in big veins, which will end in the right atrium. Now we have rules for lymph drainage. If you understand these rules, it's going to be a piece of cake. Those 7 rules are really important. Rule number 1, like veins, like lymphatics. Lymphatics end in big veins. They follow veins until they end up in the right atrium, because this is where like big veins end, in the right atrium. Arteries are vessels that carry blood from the heart to the organs. Veins are the opposite, from the organs towards the heart. Lymphatics, same as veins, they carry it from organs towards the heart, because they too end up in the right atrium. How do these lymphatics end up in the right atrium? Through the thoracic duct and the right lymphatic trunk. Rule number 2, from the superficial to the deep. We start with superficial lymphatics, then we drain into deep lymphatics. The superficial group of cervical lymph nodes will end in the deep group of cervical lymph nodes. Piece of cake. Rule number 3, no lymphatics or lymph nodes are found in the brain. Why? Why do you need lymphatics when you have the great cerebrospinal fluid? It's the same exact function. Rule number 4, cancer versus infection. Cancer lymphadenopathy is painless. Infection lymphadenopathy or lymphadenitis is painful. Rule number 5, as Dr. Stephen Covey in his book, The 7 Habits of Highly Effective People said, begin with the end in mind. What's the whole purpose? What's the end of these lymphatics? They end in thoracic duct and right lymphatic duct. The thoracic duct, in fact, drains all of the body, like 3/4 of the body. The right lymphatic duct only drains 1/4. The right side of the head, the right side of the neck, right part of the thorax, and the right arm. Everything else is in the thoracic duct. Both of them will end where? In the superior vena cava, which will end in the right atrium. Again, those great ducts are going to end in big veins. Rule number 6, focus on the organ being drained and the final lymph nodal destination, because these lymph nodes follow veins. So here is an organ, okay? You will have a group of lymph nodes, then a group of lymph nodes, then a group of lymph nodes, then a big group of lymph nodes. Focus on the organ and the final lymph nodal destination in order to be more efficient and not to waste time on all of this garbage, except if you are an anatomy professor. Rule number 7, anatomy first, pathology later. So first, I'm going to explain the anatomy. It's going to be a very boring part of the video. Then it's going to be pathology, and it's all going to be fun and rosy, which is ironic. First, head and neck. Head and neck lymphatics, they go from superficial to deep, because this is one of the rules, and they will end in deep cervical lymph node. So any structure in the head, any structure of the neck, they're going to end in the deep cervical lymph node. Even the superficial cervical lymph nodes are going to drain into the deep. How about the tongue? Upper deep cervical lymph node, because these deep lymph nodes have upper and lower groups. Okay, but in the end they are deep. Deep to what? Deep first to the superficial cervical lymph nodes and deep to the sternocleidomastoid muscle. Okay, after lymph nodes and efferent lymphatics, we have trunks. After trunks, we have ducts. Go to the first slide if you want to remember. Jugular trunk. Jugular trunk, and the right side, it's number 1. So here's the jugular trunk. Right jugular trunk, left jugular trunk. The right jugular trunk is going to end in the right lymphatic duct. Then the right lymphatic duct will drain at the junction between the right internal jugular vein and the right subclavian. The thoracic duct will end at the junction between the left internal jugular vein and the left subclavian vein. Those two will join together to form the left brachiocephalic vein. Those two will join together to form the right brachiocephalic vein, both of which will join together to form the great superior vena cava, which will end up in the right atrium. Let's talk about the retropharyngeal group. They are in the head and neck. So where's their final destination? Upper deep cervical, which is again deep cervical lymph node. So the retropharyngeal group is kind of fancy because it's in the retropharyngeal space and it's kind of disappears in after you grow older than like 5 or 6 years old. That's why retropharyngeal abscess is it's commoner in kids than adults, like way commoner in kids than adults. Okay, so nasopharynx to the retropharyngeal group, eustachian tube to the retropharyngeal group, atlanto-occipital joint to the retropharyngeal group, atlanto-axial joint to the retropharyngeal group. All of them will end in the retropharyngeal group. The retropharyngeal group itself will end in the deep cervical lymph nodes because they are part of the head and neck. Hello. Next, let's talk about the paratracheal lymph node. They are called paratracheal because they are on both sides of the trachea. Behind the trachea is the esophagus. So the trachea and esophagus, they drain into the paratracheal lymph node, which are part of the mediastinal lymph node because the mediastinum is the part between the two lungs. Okay, wonderful. To be precise, this is not all of the esophagus, this is the cervical part of the esophagus, because the abdominal part of the esophagus, that's an entirely different story that we're going to talk about next. The larynx drains into the paratracheal lymph nodes. The hypolarynx, same thing. Cervical esophagus, same thing. All of them go to the mediastinal lymph nodes. This is going to be very helpful when we talk pathology later. Next, lungs. From the peripheral to the central, they follow veins. They follow veins towards the heart, towards the big veins. Pulmonary lymphatics. They start in the superficial subpleural plexus, peripheral. And according to rule number 2, we go from the superficial to the deep. So if we go from the superficial plexus to the deep plexus, which accompanies the pulmonary arteries and the bronchi. Then we'll end up in the hilar lymph nodes because this is the hilum. The hilum is the entrance or the exit of the organ, depending on how you look at the organ. These hilar lymph nodes will end up in the mediastinal lymph nodes. So let's talk about like lung cancer, for example. If a student came and tell me the lung cancer will drain into the hilar lymph nodes causing hilar lymphadenopathy, I'll say, okay, very good. Another student came and said lung cancer will end in the mediastinal lymph nodes causing mediastinal lymphadenopathy, also correct. Okay, I thought like lung cancer is only in the mediastinum. Hey, hilars drain in the mediastinum. It's the same exact thing. Like follow the flow, follow the current, follow the crowd. Yeah, don't do the last part. Done with the thorax, let's talk about upper extremities and the breast. They end in the axillary lymph node. So if you have a problem with your hand, let's say cellulitis, necrotizing fasciitis, brachial lymph nodes first, then axillary lymph nodes. So if a student say like if I have a cellulitis in your hand, they'll end up in the axillary, it's correct. Under sophisticated student, brachial first, it's the same thing, it's correct. The skin of the anterior abdominal wall above the umbilicus will drain into the axillary lymph node. However, the skin of the anterior abdominal wall below the umbilicus will end up in the superficial epigastric, ending in the superficial inguinal. If you want to remember just one fact from this entire video, it's the fact that breast cancer will drain into the axillary lymph nodes. Fourth, the abdomen, the most well-organized part in your entire body. Foregut, midgut, hindgut. If you're talking arteries, the foregut is supplied by the celiac trunk or the celiac artery. Midgut by the superior mesenteric artery. Hindgut by the inferior mesenteric artery. If you're talking lymph nodes, same exact freaking thing. Foregut is drained by the celiac lymph nodes. Midgut are drained by the superior mesenteric lymph nodes, which happen to be around the superior mesenteric artery and vein. Hindgut will drain into the inferior mesenteric. All of these collectively are called the pre-aortic lymph nodes, which is very important. So foregut, start with the lower esophagus or abdominal esophagus, then the stomach, and the duodenum, part of the duodenum, only the upper. If I recall correctly, it's until the ligament of teres. Then the midgut, second half or the second part of the duodenum, jejunum ileum, cecum, ascending colon, and only part of the transverse colon. It's until the right 2/3. If you're gonna say until the splenic flexure, kind of okay. Next, we have the hindgut. the part of the transverse colon. Then we have the descending colon, sigmoid colon, and rectum. If I ask a student where does the rectum drain, many sophisticated students will say, above the pectinate line will drain somewhere and below the pectinate line will draw somewhere. Stupid. The pectinate line is in the anus. It's not in the rectum. The entire freaking rectum drains in the inferior mesenteric nodes. Get your head out of your sphincter. How about the anus? Above the pectinate line, below the pectinate line. You can call it pectinate line or linea pectinate. You're watching Medicosis Perfectionalis. What did you expect? Below the pectinate line, it's not part of the gut, so superficial inguinal lymph nodes, they're going to drain into the iliac lymph nodes, which are going to drain into the lateral aortic lymph nodes. Anyway, how about the upper half of the anus? Inferior mesenteric nodes. Lateral aortic lymph nodes, they have upper group and lower group. Upper group will drain the suprarenal and the renal. By the way, why is this kidney lower than this left kidney? Because of the liver. The liver is pressing on this one. Ureters, okay? Gonads, the testes and the ovaries. Big time. This is really, really, really important. Some people might feel like this is kind of weird. The testes, which are down here, will drain into the lateral aortic lymph nodes. The answer is yes. Why is that? Because when you were like a young baby in your mother's womb, called embryology, the testes were up here and the kidneys were kind of down. The kidneys went up, ascending, and the testes went down, called descending. And in some kids, the testes didn't descend. We call this disease undescended testes if you are a layman, but if you are sophisticated, you call it cryptorchitism, which means hidden testes, because they are hidden in the abdominal cavity instead of going down where they belong in the scrotal cavity. That's why the testes or the ovaries drain into the lateral aortic lymph nodes. Next, fallopian tubes and the upper uterus. How about the pelvic organs? The pelvic organs are the sacral, iliac, and inguinal. The inguinal will give to the iliac. The iliac will go to the lateral aortic lymph nodes. So, your testicle will drain into the upper lateral aortic lymph nodes. However, your scrotum will drain into the inguinal lymph nodes. And then the inguinal will go to the iliac, and then the iliac will go to the lateral aortic. If you are confused by these nodes, just know the arteries. You have the abdominal aorta, common iliac, external iliac, and internal iliac. The internal iliac is going to go to the pelvic area, okay, like uterus and bladder, stuff like that. The external iliac is going to give us the inguinal. Now, quiz time. Get a blank piece of paper and then write down those 13 questions and try to answer them. Where does the oral cancer drain? Where does the lung cancer drain? How about the laryngeal, esophageal, Hodgkin's, gastric cancer, breast cancer, colon, rectal, anal, vulvar, ureteral, which means ureter, and scrotal. And don't forget, by the way, since all of these are cancers, the lymphadenopathy is going to be painless. And since these go to a lymph node, that's the entire question, these are carcinomas by definition and not sarcomas, because carcinomas go to the lymph, sarcomas go to the blood. Are you ready for the answers? Okay, let's go. How about oral cancer? Okay, if it's oral cancer, tongue cancer, anything in the head, it's gonna be deep cervical lymph nodes. How about lung cancer? Lung cancer, that's nice. They go to the hilar, and the hilar end in the mediastinal lymph nodes. Piece of cake. How about laryngeal cancer? Laryngeal cancer, paratracheal lymph nodes, and the paratracheal will end in the mediastinal lymph node. That's excellent. Esophageal cancer. It depends. If you're talking about the cervical esophagus, that's easy. The cervical esophagus is gonna go towards the paratracheal lymph nodes, which will go to the mediastinal lymph nodes. If you're talking about the abdominal, they are different. They are going to the celiac group of lymph nodes. The celiac group of lymph nodes is part of the para-aortic lymph nodes. They are pre-aortic, but they are part of the para-aortics, because the para-aortics, they have three types. In front of the aorta, pre-aortic. Behind the aorta, retro-aortic. Retro means behind, not vintage. And then we have lateral aortic on both sides of the aorta. So, cervical esophagus, you'll go to the paratracheal, mediastinal, abdominal esophagus, celiac. Hodgkin's lymphoma. Now pay close attention. Hodgkin's lymphoma can affect any group of lymph node. However, common things are common. With Hodgkin's lymphoma, you never forget cervical and anterior mediastinal. Never, ever, ever forget that, because it's easy on the exam. You have like a patient with cervical and anterior mediastinal lymphadenopathy. Before reading the entire question, 95% of the time the answer is Hodgkin's lymphoma. But you have to read it, okay? Sometimes there are tricks. Gastric cancer, celiac, baby. That's easy. Breast cancer, you can't get that wrong. Axillary lymph nodes. Colon cancer, it depends on what part of the colon. The proximal part of the colon, which means the ascending and part of the transverse, they are part of the midgut. So answer, superior mesenteric. How about the other half? Inferior mesenteric. So colon, it depends. Alright, rectal cancer. The entire rectum is a territory of the inferior mesenteric nodes. How about anal cancer? Anal cancer, if it's only in the anal canal, we have a problem. So upper half, inferior mesenteric. That's part of it. And how about the lower half? The lower half is different. The lower half goes to the inguinal group of lymph nodes. That's above the pectinate line. How about below the pectinate line? It's going to be inguinal. Okay, superficial inguinal. Where do the inguinal end? Iliac or iliac. Then lateral aortic, as I've told you before. Vulvar cancer, same thing as anal. This is the perineum. This is perineum territory. So it's going to be the same exact thing. Vulvar cancer will be inguinal, and then inguinal go to the iliac. If you want to be super sophisticated, the external iliac. Okay, honey. Then lateral aortic lymph nodes. How about ureteral cancer? Ureter, that's kidney, baby. And the kidney is just next to the lateral aortic lymph nodes, which are part of the para-aortic lymph nodes. Hello. What are the pre-aortic, by the way? Pre-aortic are the three of the gut: celiac, superior mesenteric, and inferior mesenteric. Those drain the gut. Those are called pre-aortic. Retroaortic, they drain the posterior abdominal wall. Who cares? Lateral, they are drained like renal, suprarenal, and ureters. Then don't forget the gonads. How about scrotal cancer, baby? Scrotum. I didn't say testicular. Scrotal cancer, same thing as vulvar and anal. This is perineum land. Inguinal, going to iliac, or going to lateral aortic lymph nodes. Okay, let's make it harder. Okay, let's do testicular. Testicular cancer. Answer, lateral aortic, because testes is a gonad. Ovarian cancer. This is lateral aortic lymph nodes. If you have listened to everything that I have said in this slide, and you can write it down, instead of 13, you can write 20 or whatever, and you just memorize that, you should be fine. Now we are done with the painless lymphadenopathy. Let's talk about painful lymphadenopathy. Infections, baby. Upper respiratory tract infection. This is head and neck, baby. It's gonna be the deep cervical. Hello, it's a piece of cake. Kawasaki, cervical. This is something you have to memorize because Kawasaki affects the cervical lymph nodes for some reason. Mononucleosis, cervical lymph nodes. It's called the kissing disease. So just go close to the mouth. If you don't know anything in medicine, it's called kissing disease, and you have to pick a lymph node. Pick something close to the mouth, you stupid idiot. It's going to be the cervical. Tuberculosis and sarcoidosis. They can go first to the hilar. But the hilar, as you know, ends in the mediastinal lymph nodes. Again, hilar, mediastinal lymph nodes. Don't forget, tuberculous granulomas are caseating, but sarcoidosis granulomas are non-caseating granuloma. Mastitis, you cannot go wrong with that, axillary lymph node. What's the difference between mastitis and breast cancer in terms of lymphadenopathy? Mastitis is painful axillary lymphadenopathy. Breast cancer is painless axillary lymphadenopathy. Ulcerative colitis, this is the gut land, so it's gonna be pre-aortic group because the pre-aortic contains celiac, superior mesenteric, inferior mesenteric. If it's called colitis, it's gonna be the colon, so it's either superior mesenteric or inferior mesenteric nodes. Sexually transmitted infections, you have two choices, the internal iliac or it's gonna be the inguinal. If it's kind of deep, okay, like cervicitis or whatever, vaginitis, it's gonna be internal iliac, but if it's superficial, vulvar problem or scrotal problem or tip of penis or whatever, it's gonna be inguinal. Lower limb cellulitis, it depends on what you're talking about. So if this is the nice leg, here is behind the knee, popliteal, and then here is the inguinal group, femoral first, then inguinal. Okay, so if it's leg cellulitis, it's gonna go to popliteal lymph nodes, and popliteal will go to the femoral. If it's here above the knee, it's gonna go femoral. Piece of cake. Let's use the Pareto principle, the great Italian scientist and mathematician. 20% of information are gonna give you 80% of the results. Actually, Pareto never said that, but it's kind of an okay description. So here are 20% of the information, but they can help you tremendously on your exam. Pay attention. Upper extremities and breast cancer, you cannot get that wrong. Axillary nodes. GIT, gonads, and kidney aortic lymph nodes. Want to be sophisticated? The gonads and the kidney go to the lateral aortic lymph nodes, which are part of the para-aortic lymph nodes. Gastrointestinal malignancies, gastric and pancreatic cancers, for example, can go to the peri-umbilical node. Of course, they are gonna go to the celiac, superior mesenteric, etc. However, they can go to the peri-umbilical nodes. These are called Sister Mary Joseph nodes. Penis, scrotum, perineum, vulva, anus, lower extremities, inguinal lymph nodes. So penis, inguinal. Testes, lateral aortic. High yield, lymphadenopathy again. Cancer is painless lymphadenopathy. Infections are painful lymphadenopathy. Let's talk about Virchow's node. Actually, the accurate pronunciation is Virchow's node. This is German. Respect the language. Virchow's node is the same thing as left supraclavicular lymph node. The left supraclavicular lymph node eventually is part and parcel of the thoracic duct. So thoracic duct will take the upper left of your body and all of your lower body. Okay, that's excellent. Let's talk about it. It's about above the clavicle, no kidding. It's called supraclavicular. In the supraclavicular fossa, they drain the abdominal cavity. You know why? Because the abdominal cavity are part of the thoracic duct and not the right lymph trunk. So let's say gastric cancer. Do you think gastric cancer is going to go to the left supraclavicular lymph node or the right supraclavicular lymph node, you stupid idiot? It's going to go to the left supraclavicular lymph node because all of this abdomen is part of the thoracic duct territory. The left supraclavicular is called Virchow's node, but the right supraclavicular doesn't have any specific name. Gastric cancer, left supraclavicular. Ovarian cancer, oh, the ovaries here, it's part of the thoracic duct and not the right lymphatic trunk. Testicular, they're going to go to the lateral aortic, then they will go to the thoracic duct. Part of it is the left supraclavicular lymph node. Breast cancer, same thing. Okay, so describe the Virchow's node when it has cancer due to metastasis or secondary. It's hard, enlarged, painless lymphadenopathy. We call this Troisier sign. Tuberculosis, sarcoidosis, toxoplasmosis can cause enlarged, painful Virchow's node. Remember the difference between painful and painless. If you want to add histoplasmosis together with toxoplasmosis, tuberculosis, and sarcoidosis, I don't give a rip. If you find an enlarged Virchow's node, which is the left supraclavicular lymph node, and an enlarged Sister Mary Joseph node, which is peri-umbilical, at the same time in the same patient, think abdominal malignancies such as gastric and especially pancreatic cancer. So you have a patient, you are doing lymph node exam, you find left supraclavicular enlarged, hard, painless lymph node, and his peri-umbilical lymph nodes, again, are enlarged and painless. Think abdominal malignancies such as gastric and pancreatic. Big time, don't ever forget that. Remember rule number 5, begin with the end in mind. What's the purpose of all of this? If you are this quarter of your body, it's going to go to the right lymphatic duct. And they can go to the right supraclavicular node. So let's say that you have a problem here, okay? Or cancer in any part of this region. They're going to go to the right supraclavicular node, causing painless lymphadenopathy. However, if you have stomach cancer, this is Virchow node territory, which is part of the thoracic duct. How about testicular cancer? Same thing, Virchow node. Very good. How about if we have pancreatic, Virchow node? You get the idea. So, the thoracic duct carries lymph and chyle. Left supraclavicular node is part of the thoracic duct. It's called Virchow node. That's why ovarian cancer, pancreatic cancer drain to the left supraclavicular node and not the right one, because this is green territory. This is thoracic duct territory because they are drained by the thoracic duct. High yield note. Sometimes the thoracic duct can rupture, especially during esophageal surgery, because some surgeons are idiots. They just hit the thoracic duct, contains lots of lymph and chyle. So when it ruptures, you get chylothorax, baby. Accumulation of chyle, which is different kind of lymph, in the pleural cavity, which is not fun. And what's even not fun is that this chyle contains lots of antibodies, white blood cells. All of your warriors and the military personnel are in the chyle. When the stupid surgeons ruptured the chyle, theoretically, at that time you are immunodeficient. Some extra notes. Cancer spread by contiguity or metastases. Lymphoma can spread by contiguity, especially Hodgkin's lymphoma, which means contiguous spread from this lymph node to the next lymph node, 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 locally. However, non-Hodgkin's is globally. They metastasize and they can cause generalized problem all over your place. Cancer in the lymph node could be primary, called lymphoma, or secondary, coming from a metastasis from outside, from lung cancer, from gastric cancer, from testicular cancer, from whatever. But it has to come from a carcinoma and not a sarcoma. Not 100% of the time, but most of the time. Secondaries are the same thing as metastases. Don't be fooled by this. Something to never forget in your life. You have a lady with breast cancer, and for treatment purposes for that breast cancer, you did radical mastectomy, which means removal of the breast, and radiation or dissection to the axillary lymph nodes. Okay, now she's fine. Several months later, she comes with secondary lymphedema in the upper extremity at the same side of lymph node dissection. Let's say she had breast cancer in her left breast. You removed the left breast and the left group of axillary lymph nodes. Several months later, she will come like this. Here is this nice lady, okay? And here is her left arm. It's gonna be like this, okay? Because you removed the lymph node, now she has secondary lymphedema, which is non-pitting edema, in the upper extremity at the same side of the removed breast and lymph node. 5 to 10 years later, she can develop lymphangiosarcoma because she has lymphedema for so long. If you know anything about cancer, when you have a trauma or an injury or something wrong for a long time, you're increasing your risk of cancer. This is called lymphangiosarcoma. It's called sarcoma, so if it metastasizes, it's gonna go to the blood and it's gonna be horrible. Okay, let's do it again. How about tongue cancer, cervical lymph nodes, Hodgkin's lymphoma, cervical lymph nodes, infectious mononucleosis called kissing disease, cervical lymph nodes, Kawasaki, cervical, retropharyngeal abscess, cervical, upper respiratory tract infection, cervical, breast cancer, mastitis, axillary. This is painless, this is painful. Tracheal, any tracheal problem, cervical esophageal cancer, esophageal cancer in the cervical part of the esophagus, laryngeal cancer, laryngitis, paratracheal lymph nodes, mediastinal lymph nodes. Tuberculosis, sarcoidosis, lung cancer, good pastures, paratracheal lymph nodes. If you want to say all of this can go to the hilar than the mediastinal, I don't care. That's true. Tuberculosis, sarcoidosis, hilar than mediastinal. Foregut, midgut, hindgut, respectively. Celiac, superior mesenteric, inferior mesenteric. This group is called pre-aortic lymph nodes. Suprarenal gland, or any problem in the suprarenal gland. Renal problem, renal cancer, or renal cell carcinoma. Urethral problem, lateral aortic. Gonads, testicular cancer, ovarian cancer, lateral aortic. Fallopian tube and upper uterus, lateral aortic. How about the lower uterus? Gonna be iliac. Hello. Upper part of the vagina. So lower uterus, cervix, upper part of the vagina. So if you have cervicitis, it's gonna be iliac. Lower part of the vagina, inguinal. Anal cancer, inguinal. Proctitis, which means inflammation of the anus, inguinal. Vulvar, inguinal. Scrotal, inguinal. This is perineum territory, which is an inguinal territory. Lower extremities, femoral, baby. Cellulitis of the foot or necrotizing fasciitis of the foot or the calf, anything below the knee, popliteal, baby. That's lymphatic drainage as it should be, because this is Medicosis Perfectionalis, where medicine makes perfect sense. So please subscribe, hit the bell, follow me on Facebook, Twitter, Instagram, and please support this channel on Patreon. Thank you for watching. This is Medicosis Perfectionalis. Be safe, stay happy, and study hard.